Community leader in a heated confrontation with protesters on Capitol Hill. She says the Black Lives Matter movement is being taken over by another agenda. KOMO's Tammy Mutas is live with a video that's been shared thousands of times. Tammy?
Mary, Victoria Beach is frustrated and fed up. She says since May, she's been watching her neighborhood getting destroyed in the name of Black Lives Matter. And she says rioters don't represent the black community and what's being fought for. This is the moment Victoria Beach calls her tipping point.
She just said that.
The community activist is seen in this Twitter video surrounded by protesters dressed in all black with umbrellas, then pushes one of them.
You know, I'm not proud of that action, but I'm not sorry either.
Victoria says she was demanding them to stop using the Black Lives Matter movement as an excuse to cause destruction in her neighborhood week after week.
The girl flipped me off and called me a few names, and I lost it. I shoved her.
You have assaulted officers.
Seattle police say during the march on October 17th, vandals set a small fire, spray-painted buildings, and even blocked traffic, delaying a fire department vehicle rushing to a hospital. 5 people were arrested. Beach chairs the African American Community Advisory Council, pushing for better police relations in communities.
You're not going to do this in my neighborhood, and how dare you disrespect George Floyd and his family. We don't protest like this, and stop using Black Lives Matter.
And it has nothing to do with 8 minutes and 46 seconds anymore. It's somebody else's agenda.
Law enforcement expert Jim Fuda says it's not the smartest move to confront groups, but he says the video exemplifies the frustration over the lack of city accountability.
God bless her. Stuff like this is going to continue to happen until our council takes some responsibility.
Just like they told me to shut up and go home, that's what they need to do.
Yeah, a week away. Hard to believe, Eric. Well, anecdotally, this is what I'm hearing out here. I've been to a lot of drop boxes, and everybody wants to get that ballot in early. They want to make sure it's counted. Well, get this, so does the state. And in fact, so does that Unverified website.
On Monday came a warning from the Secretary of State about trusting official election sites. A day later, this warning spelled out in a tweet, calling out the website votewashington.info, letting voters know it's unverified and not an official election site. For an official source, Secretary Wyman is directing voters to the state's votewa.gov.
One of the things that we're really sharing with people is a hashtag called TrustedInfo2020. It's really trying to drive people to trusted news sources.
One of the Unverified website's developers told me while theirs is not an official site, quote, it is a useful tool accessing publicly available voter data with the goal to improve voter turnout and empower citizens to identify ballots with signature challenges. Voters right now are hyper engaged, voting and wanting to ensure that their votes are counted.
We've been taking your ballot questions to get answers. We heard from Beverly. She was worried about tampering. She got her ballot, but that stub that's on it, it was already off.
It's really an accounting feature. Whether it is attached or not attached to your ballot when you receive it really doesn't affect whether or not it's going to be counted or whether it's valid. It's really more of an accounting purpose.
The other big question we've been getting from a lot of people, I didn't get a ballot. What do I do? Well, got to make sure you're registered and then you can vote. Here's the deal. You can't do it online. You got to do it in person. You got to go to one of the voting centers or an election office.
I would encourage you to do it soon. The earlier you can do that, the better. We are already starting to see lines form, and the closer we get to Election Day, the longer those lines will be.
I'm 90 and a half years old. We got our ballots in as quickly as we could.
Our next question comes from Mary. She says she panicked because her son dropped her ballot in a Marysville drop box, but she lives in Arlington. We checked. It's not a problem.
That makes me feel better.
30% of those we polled on Twitter say that they'll get a COVID-19 test before gathering with family this holiday season. To weigh in, search for us at KOMO News. And while doctors say testing is important, they emphasize the danger of relying on tests alone to prevent the spread of the coronavirus. KOMO's Abby Aconi is live to explain more about that. Abby?
Hi there, Eric. Doctors say that using tests as a single measure to protect against coronavirus is a hazardous strategy and is reactive versus proactive.
If we're not aware, COVID not go anywhere.
People we talked to today are cautious heading into the holiday season, wanting to use every measure possible to prevent the spread of COVID-19.
I think all the practices are needed of masks and keeping distance, and we got to do everything we can.
No, don't get complacent. I mean, now is not the time to get complacent with this disease.
This winter, doctors say even the best testing isn't enough to contain coronavirus on its own. Instead, UW professor of infectious diseases, Dr. Paul Pottinger, says a combination approach is best to keep our loved ones safe in the months ahead.
You still have to do those basic things to protect yourself, like covering your face, giving people personal space, plenty of fresh air when you're around other people.
Doctors tell me that COVID-19 tests have several limitations. First of all, while it's rare, coronavirus tests can produce inaccurate results. You can get coronavirus and even become contagious before the virus is detected in the test. Lastly, these tests are just a snapshot in time. A negative test doesn't mean you couldn't test positive a day or two later. Here's Dr. Ali McDodd with UW's Institute for Health Metrics and Evaluation.
A negative test today means today I don't have the virus in my system. But it doesn't mean I was exposed to somebody who had COVID-19 before. And it doesn't mean that I will not get the virus in 2, 3, 4 days later.
Out of next week's election, and we have a closer look at Proposition 1 in King County.
The $1.74 billion bond measure would provide public health, safety, and seismic improvements to Harborview Medical Center. KOMO's Suzanne Fawn explains what that would include.
Prop 1, a $1.74 billion bond measure for improvements over 20 years to Harborview Medical Center. The measure includes $925 million for a new tower, $79 million for a new outpatient behavioral health building, $700 million for seismic upgrades and other building renovations. Niru Kaur is a respiratory therapist at Harborview.
I work everywhere, ICUs, floors, with all kinds of patient population. And we've worked a lot with the COVID patients.
Right now, Harborview is overflowing with patients, especially with the COVID crisis. It operates at 100% capacity, almost daily.
The Prop 1 bond measure requires a 60% approval rate to pass. If approved, it would cost an additional $61 a year for the median household.
While I'm not a big supporter of tax increases, this is something we can't do without.
King County Metro bus driver Eric Stark was a patient at Harborview.
I needed Harborview's services last March when I was shot while I was driving a bus for Metro. I remember being wheeled into the emergency room and just thinking, what a zoo this is. I mean, there were beds everywhere.
I think this bond initiative that's before the voters really is an opportunity for Harborview to meet not only the current generation in terms of healthcare, but future generations by really creating state-of-the-art facilities.
Hey everybody, I'm Eric Johnson from KOMO News. Thanks for checking out the KOMO YouTube channel. You can see more of our videos right here by clicking on the video links for more news from the Seattle area and all of Western Washington. And don't forget to click the subscribe button below so you don't miss our YouTube updates.